Welcome to your first day of training at AMH Mental Health Center. Today we are going to start your training as a medical practice administrator. There are many administrative positions in the medical field, but your position is very important. Effective practice administrators in a mental health setting balance administrative obligations with ancillary medical duties. They provide leadership to office staff and ensure compliance with government regulations. The job is complex and requires meticulous thought and attention to detail. The mental health setting can be unsettling, and the practice administrator knows its smooth operation depends on her leading a competent staff. There are 4 major areas a practice administrator will be working in: administrative, medical records, billing and coding, and supervision. Medical practice administrators in a mental health setting are usually responsible for standard administrative duties. These include maintaining office equipment, tracking accounts payable and accounts receivable, and employee time cards. They maintain standard operating procedures, in some cases meeting minutes. And they also might take on the role as the front desk, thereby scheduling appointments and maintaining physicians' calendars. In a mental health setting, practice administrators are kept abreast of crisis intervention services and procedures in the event of a psychotic episode. Here at AMH, the practice administrator will oversee that the medical records of the mental health patients are organized and up to date. They will also routinely spot check records for accuracy. The practice administrator is responsible for coding patient diagnosis and billing insurance companies and patients for service rendered. They track payments and monitor accounts for delinquent charges, and in some cases, they will arrange payment options with patients who are unable to pay. Practice administrators supervise the clerical staff. They ensure compliance with patient care and front desk duties. They monitor time and attendance for clerical staff and regulate the workflow. They do most of the hiring for clerical support staff members and terminate staff members as warranted. There are many forms that a practice administrator would use, from CMS 1500s to patient registrations to evaluation forms. Luckily, these forms are no longer filled out by hand. Medisoft is a proven practice management system that delivers streamlined scheduling and billing functionality along with complete revenue management capabilities. Everything that was once done and filled out by hand is done through Medisoft. Money is lost here at AMH when jobs are not done correctly the first time. Managing chronic offenders that consistently miss appointments, verifying patients' insurance, and following up on claims are just ways to keep money from being lost in this business. Not only do mental health centers use ICD and CPT codes, but they also use DSM-5 codes. A diagnostic and statistical manual of mental disorders, which is the Mental Health Bible, serves as a universal authority for psychiatric diagnosis. It's a classification and diagnostic tool that is used in the United States. Congratulations! You have finished your first day of training, which has been an overview of what a practice administrator does here at AMH. We know we have chosen the right candidate. Welcome aboard.